Every single morning, millions of Americans over 60 shuffle to the kitchen, pour their coffee, and then dread the walk to the mailbox. The knee pain hits before they even reach the front door. That grinding, aching, swollen feeling that was not there 10 years ago and that every doctor seems to have the same answer for. Take this pill, get this injection, come back in 3 months, and the pain comes back every single time. What if the answer was already sitting in your kitchen? What if I told you that what you put in your morning coffee could begin changing the chemistry of your inflamed knee joints within days? Stay with me, because what I'm about to share is going to change your mornings. My name is Dr. James Mercer. I am a board-certified physician with 35 years of clinical practice and over 40,000 patients treated across those decades. I have worked in this hospital long enough to have seen every pharmaceutical solution the industry has to offer for knee pain in seniors. The NSAIDs, the cortisone shots, the knee replacement referrals. And I want to be honest with you the way I am, honest with the patients who sit across from me in my examination room. Medications manage pain. They do not touch the underlying biology that is creating it. What I'm going to show you today does something different. It goes to the source. Before we get to the solution, I want to make sure you understand exactly what is happening inside your knee right now, because you deserve to know the full story. And the full story is one most physicians simply do not have the time to tell. The knee joint is one of the most complex weight-bearing structures in the human body. Inside that joint, between the ends of your femur and tibia, sits a layer of smooth tissue called articular cartilage. Its job is to act as a perfect shock absorber, a biological cushion so precise that engineers have spent decades trying to replicate it in artificial joints and have never fully succeeded. That cartilage is kept alive and lubricated by a fluid called synovial fluid, which is produced by a membrane lining the inside of your joint capsule. Now, here's what happens after 60, and I want you to understand this is not simply wear and tear in the way people casually describe it. After 60, your body produces measurably less type 2 collagen, the specific protein that forms the structural scaffolding of cartilage tissue. At the same time, a class of inflammatory molecules called cytokines, specifically interleukin-1 and tumor necrosis factor alpha, become more active inside the joint environment. These cytokines are like biological fire. They degrade the cartilage matrix faster than your body can repair it. They inflame the synovial membrane. They stimulate the release of enzymes that actively break down the cushioning tissue, and what results is the classic picture of knee osteoarthritis in someone your age. Thinning cartilage, inflamed joint lining, reduced synovial fluid, and a grinding, aching pain that is worst in the morning and after sitting still for a while. Now, here is the number that should stop you cold. Osteoarthritis of the knee affects somewhere between 10 and 15% of everyone over the age of 60. That is tens of millions of Americans right now. And the standard pharmaceutical approach, the ibuprofen, the naproxen, the prescription anti-inflammatories, they work by blocking certain enzymes in the inflammatory cascade, but they do so systemically. They hit the entire body. And in my 35 years of practice, I have watched those medications erode stomach linings, strain kidneys, elevate blood pressure, and accelerate cardiovascular risk in the very population that can least afford those side effects. The senior population, your population. There is something fundamentally wrong with a system that gives an 68-year-old an NSAID prescription without discussing the gastrointestinal and cardiovascular risk profile. And most patients are never told. I am telling you today. But here is what I also want you to understand before we get to the coffee protocol. Pain is not the disease. Pain is the signal. The disease is inflammation. Specifically, a dysregulated, chronically elevated inflammatory environment inside the joint that keeps breaking down tissue faster than the body can rebuild it. The moment you understand that, the moment you shift your goal from managing the symptom to addressing the inflammatory chemistry, everything changes. and the most powerful natural anti-inflammatory compound documented in modern science can be stirred into your morning cup of coffee in about 30 seconds. Let me show you what I mean. Here is the compound I want you to start using tomorrow morning. Curcumin, the active polyphenol extracted from the spice turmeric. I know some of you have heard this before. I know some of you have tried turmeric and thought, this does nothing. And I am going to tell you why that happened and why, when you use it correctly, the results are dramatically different. Curcumin works by directly inhibiting the same inflammatory enzymes and cytokines that drive knee osteoarthritis at the molecular level. It suppresses NFKB, which is essentially the master switch that turns on the inflammatory gene expression cascade inside your joint cells. It reduces the production of prostaglandin E2, one of the primary chemical mediators of joint pain and swelling, and it has been shown in multiple randomized controlled trials to reduce WOMAC pain scores, which is the gold standard clinical measure of knee osteoarthritis symptoms, at levels comparable to ibuprofen and naproxen, with none of the gastrointestinal damage, with none of the kidney strain. A systematic review and network meta-analysis published in BMC Complementary Medicine and Therapies in 2025 analyzed 17 randomized controlled trials comparing turmeric preparations to placebo for knee osteoarthritis. The finding was unambiguous. All turmeric preparations studied significantly reduced WOMAC pain scores, all of them. And a separate meta-analysis published in the Journal of Rheumatic Diseases found that curcumin and turmeric extract had treatment efficacy for knee pain similar to NSAIDs based on evidence from 16 randomized controlled trials involving over 1,800 adults. You read that correctly. Similar to NSAIDs without the side effects, without the prescription, without the cost. But here's the critical piece that separates the people who try turmeric and feel nothing from the people who experience real meaningful pain reduction. Curcumin on its own has extremely poor bioavailability. Left to its own devices, less than 5% of the curcumin you swallow actually reaches your bloodstream in a biologically active form. The liver processes it rapidly. The digestive system eliminates most of it before it ever gets a chance to work. That is where the coffee protocol becomes the delivery vehicle. And this is the part I want you to pay close attention to. When you add turmeric to a fat-containing beverage like whole milk or cream in your morning coffee, the fat molecules physically encapsulate the curcumin and carry it through the intestinal wall with dramatically better absorption. But there is another ingredient that changes the bioavailability equation completely, and it is something you almost certainly already have in your kitchen. Black pepper. A pinch of freshly ground black pepper added to your morning coffee alongside turmeric contains a compound called piperine. Piperine inhibits the liver enzymes that rapidly metabolize and eliminate curcumin from your system. The result, published in the journal Planta Medica and replicated in multiple subsequent studies, is that piperine increases the bioavailability of curcumin by approximately 2,000%. Not 200%, 2,000%. That is the difference between a supplement that does nothing and a compound that is actually circulating in your bloodstream at therapeutic concentrations. This is the information that should be on the label of every turmeric supplement sold in America. Most people have no idea it exists. And there is one more ingredient I want to add to your morning coffee protocol that addresses a completely different mechanism of knee pain: hydrolyzed collagen peptides. These are short-chain protein fragments derived from collagen that have been broken down by enzymatic hydrolysis into a form small enough to be absorbed through the gut wall and transported directly to cartilage tissue. A randomized double-blind placebo-controlled trial published in 2024 in a major nutrition journal enrolled adults aged 30 to 81 with confirmed knee osteoarthritis and found that daily collagen peptide supplementation significantly reduced both pain scores and inflammatory biomarkers, including C-reactive protein, after 6 months. Additional research published in the Journal of Orthopedic Surgery and Research in 2023 analyzed 4 randomized trials covering 507 knee osteoarthritis patients and found a statistically significant difference in pain relief favoring collagen peptides over placebo. Here's how the biology works. The collagen peptides you consume are absorbed and travel to the cartilage tissue of your joints. There, they act as raw material and as a biological signal to the fibroblast cells responsible for cartilage maintenance. Those cells, called chondrocytes, respond to the presence of collagen peptide fragments by increasing their own production of type 2 collagen. Your knee is not just receiving an anti-inflammatory message, it is receiving the building blocks and the biochemical instruction to start rebuilding. This is the revelation. You are not just reducing pain, you are changing the repair equation inside the joint itself. Now, let me give you the exact protocol step by step starting tomorrow morning. The first thing is the morning coffee preparation. You are going to use 1 full cup of coffee brewed in whatever way you prefer. Into that cup, you are going to add 1 level teaspoon of high quality turmeric powder. I want you to look for a turmeric product standardized to at least 95% curcuminoids. That specific standardization tells you the concentration of active compound in what you are buying. Generic grocery store turmeric contains curcumin, but at inconsistent and often low concentrations. For therapeutic purposes, you want the standardized extract. Cost is minimal. A month's supply runs $3 to $5. Into that same cup, you are going to add 1 pinch of freshly ground black pepper. A pinch is approximately 1/8 of a teaspoon. You do not need more than this. The piperine required to achieve that 2000% bioavailability boost is a very small quantity. If you grind fresh black pepper, it contains higher piperine concentration than pre-ground pepper that has been sitting in a container for months. Invest in a small pepper grinder. It costs less than $3 and it matters. Now, here is the collagen step. You are going to stir 1 tablespoon of hydrolyzed collagen peptide powder into that same cup of coffee. High quality collagen peptide powder dissolves completely in hot liquid. You will not taste it. You will not smell it. It will look and smell like your regular morning coffee. The research on knee osteoarthritis has shown consistent results at doses of 10 grams per day, which is approximately 1 tablespoon. Buy a product labeled hydrolyzed collagen or collagen peptides, not gelatin, not whole collagen, hydrolyzed specifically. The hydrolysis process is what reduces the molecular weight to a form your gut can absorb. At your age, and I want to say this very directly, after 60, your gut absorption efficiency has naturally declined. The lower molecular weight of hydrolyzed collagen peptides is specifically what compensates for that. A product that works well for a 35-year-old may not achieve the same absorption in a 65-year-old unless it is properly processed. This is the difference most supplement companies never discuss. Add your usual creamer, whole milk, or a tablespoon of coconut oil or MCT oil to your coffee as well. The fat content is what provides the lipophilic carrier for the curcumin. If you drink your coffee completely black, add the fat specifically for this purpose, even if it is just a splash of whole milk. The fat is not optional in this context. It is part of the delivery mechanism. Drink this every single morning within 30 minutes of waking. Consistency is everything. The anti-inflammatory benefit of curcumin builds in your system over days. It is not like an ibuprofen that hits fast and hard. It is a sustained biochemical shift in your joint environment. Most people who follow this protocol consistently report meaningful changes in morning stiffness and walking pain within 5 to 10 days. Now I want to give you the second piece of this protocol, because what you drink in the morning is only half the equation. What you do with your body in the 2 hours after that coffee matters enormously. After your morning coffee, every single day, I want you to do what I call the joint activation sequence. This is not a workout. This is a 10-minute movement protocol specifically designed to restore synovial fluid circulation in the knee joint. Here is the biology. Synovial fluid does not have its own circulation pump the way blood does. It moves and distributes within the joint only through movement and compression. When you sit still for 7 or 8 hours of sleep, the synovial fluid in your knee pools and partially stagnates. The cartilage surfaces that depend on this fluid for nutrition and lubrication are not being served. Morning stiffness is partially the result of a joint that has been deprived of active fluid distribution overnight. What you do in the first 30 minutes after waking directly determines how well that fluid distributes and how that joint functions for the rest of the day. Start with seated knee extensions. Sit in a chair and slowly extend one knee fully until the leg is straight. Hold for 3 seconds and lower it. 10 repetitions per side. This gentle compression and decompression cycle literally pumps synovial fluid across the cartilage surface. Then move to 10 gentle heel raises from standing. rising up on the balls of your feet slowly and lowering slowly. Then do a slow 10-minute walk, not for fitness at this point, for joint fluid circulation. Arm swinging actively, moderate easy pace, no hills in the first week. This sequence, the coffee protocol plus the morning movement protocol, is what produces the 7-day result, not one or the other, both together. Now, let me give you the third piece that most people never hear. And this one is about what you need to remove from your diet immediately if you are serious about getting out of knee pain. Because you can add every beneficial compound in the world to your morning coffee, and it will be fighting an uphill battle if you continue eating the foods that systematically fuel the same inflammatory cascade you are trying to reduce. The single biggest driver of chronic systemic inflammation in the American senior diet is refined omega-6 seed oils, soybean oil, canola oil, corn oil, vegetable oil. These are in virtually every processed food, every restaurant meal, every packaged snack. These oils contain extraordinarily high levels of omega-6 polyunsaturated fats that the body converts into arachidonic acid, which is the direct precursor to the prostaglandins and leukotrienes that inflame your knee joint. In my 35 years of practice, I have never seen a patient with severe knee osteoarthritis who was not consuming significant quantities of these oils, not once. Replace them entirely with extra virgin olive oil for cooking and dressing. Extra virgin olive oil contains a compound called oleocanthal that inhibits the same COX-1 and COX-2 inflammatory enzymes that ibuprofen inhibits. At typical daily cooking quantities, the dose is biologically meaningful. The second dietary removal that will accelerate your results dramatically is refined sugar and high fructose corn syrup. Sugar directly stimulates the production of advanced glycation end products, which are compounds that stiffen and damage collagen structures throughout the body, including joint cartilage. If you are drinking 2 sodas per day alongside your turmeric coffee, you are taking 1 step forward and 2 steps backward. The sugar must come down. You do not have to eliminate every gram, but the major sources, sweetened beverages, packaged desserts, sweetened cereals, flavored yogurts, those need to come off the table starting now. The third addition I want you to make beyond the morning coffee protocol is a daily serving of wild-caught fatty fish, sardines, wild salmon, mackerel. The omega-3 fatty acids, EPA and DHA in these fish directly compete with and displace the omega-6 arachidonic acid pathway at the cellular membrane level. They shift the cellular chemistry of your joint tissue away from inflammatory prostaglandin production and toward anti-inflammatory resolution compounds called resolvins and protectins. Eat this 3 times per week at minimum. If cost or access is a limitation, a high-quality triglyceride-formed fish oil taken with your largest meal achieves a similar result. Now, let me tell you something that took me decades of practice to fully appreciate, and that most doctors working within the current medical system are never going to sit down and explain to you. The pharmaceutical management of knee pain in seniors is one of the most profitable sectors in all of medicine. The anti-inflammatory drug market alone generates tens of billions of dollars annually. The knee replacement surgery market generates tens of billions more. And somewhere in between those two revenue streams, in the space between the first prescription for naproxen and the eventual surgical consult, is an enormous missed window, a window during which the biology of the knee joint is still responsive to nutritional and lifestyle intervention. Here is what the published science shows, but the system has no financial incentive to communicate to you. Curcumin at standardized doses has been shown in meta-analyses to achieve pain reduction comparable to NSAIDs. Hydrolyzed collagen peptides have been shown in randomized controlled trials to reduce inflammatory markers, including C-reactive protein in knee osteoarthritis patients. The piperine-curcumin combination is documented in peer-reviewed research to achieve 2,000% increases in bioavailability. None of this is fringe science. None of this is health bloggers making claims on the internet. This is published randomized controlled trial data in major medical journals. And the reason your doctor has likely never mentioned the morning coffee protocol is not that it does not work. It is that there is no mechanism in the healthcare system to bill for it. I will say it plainly because I think you deserve plain talk. A bottle of standardized turmeric curcumin costs about $15 per month. A bag of hydrolyzed collagen peptides costs about $20. A pepper grinder costs $3. The total investment in this protocol is somewhere around $35 to $40 per month. Compare that to the average cost of a cortisone injection, which runs several $100s and provides temporary relief that research shows diminishes with each subsequent injection. Compare it to the long-term NSAID cost in terms of both dollars and the damage to your gut lining. Compare it to the eventual cost, financial and physical, of a knee replacement surgery and its recovery period. I am not anti-medicine. I perform medicine for 35 years. I am pro-patient, and pro-patient means telling you about the $35 option before we discuss the $35,000 one. Now, I want you to imagine three futures, and I want you to really sit with each one for a moment. In the first future, you close this video and you do nothing different. Your morning coffee stays the way it is. The knee pain that greets you when you get out of bed tomorrow morning is still there next week and the week after that. 6 months from now, the inflammation has continued its quiet work inside your joint. The cartilage continues to thin. The morning stiffness has added another 10 minutes to your getting ready routine. You make another appointment, get another short-term solution, and the cycle continues. In the second future, you try this protocol for a few days with half-hearted consistency. You use it Monday, Wednesday, and Friday, but skip the weekend. You add the turmeric, but forget the black pepper 3 days out of 7. You add the collagen for a week, but run out and forget to reorder. You notice some modest improvement and then plateau. You tell yourself it sort of works, but not enough. The biology requires consistency because the anti-inflammatory mechanism builds cumulatively. Partial compliance yields partial results, and partial results tend to convince people the approach does not work rather than that the approach needs fuller commitment. In the third future, you start tomorrow. You buy the standardized turmeric extract. You buy the collagen peptides. You pick up a pepper grinder. For 7 days straight, the morning coffee is made exactly as I described. Every morning, you do the 10-minute joint activation sequence before you sit down. You switch your cooking oil to extra virgin olive oil this week. You have salmon or sardines 3 times in the first 7 days. At the end of day 7, you stand up from your chair and notice the first 2 steps toward the kitchen do not have that grinding resistance they had before. The walk to the mailbox happens differently, not pain-free necessarily, but noticeably different. And you realize for the first time in a long time that the trajectory of your knee health is something you have actual influence over. That third future starts with tomorrow morning's coffee. The ingredients are available today. The decision is available right now. Here's what I know after 35 years of sitting across from patients who have tried everything the system prescribed and still lived in pain. The body is never beyond responding. The knee joint is living tissue. It responds to the inputs it receives. Give it the chemistry for repair and reduce the chemistry of inflammation, and it will begin to change. Maybe not as fast as a cortisone injection, but unlike a cortisone injection, the change it makes is building towards something instead of borrowing against a future that arrives worse. You deserve to walk without pain. You deserve mornings that do not start with a negotiation between you and your own knees. And you deserve a doctor who tells you about the turmeric, the collagen, and the pinch of black pepper before writing another prescription that treats your joint like a problem to be managed rather than tissue that can genuinely improve. I am Dr. James Mercer. Before you leave today, I want to hear from you in the comments. Tell me how long you have been dealing with knee pain and whether you have ever tried turmeric or collagen before. Your answer is going to shape what I cover next on this channel. I read every comment, every single one. If this gave you something useful today, and I believe it did, hit that subscribe button right now. Next week, I am going to reveal the specific bedtime habit that could be actively accelerating cartilage breakdown while you sleep, and the 3-minute fix that changes it. You will not want to miss that one. I will see you next week.